April Johnson, a technical assistant consultant with Infant Toddler Connection of Virginia. If you've ever wondered why a baby or toddler is biting, throwing toys, or having a meltdown during simple routines, you're not alone. Big feelings in babies and toddlers are expected. It's how children learn to communicate before they even have words. Challenging behavior can be confusing and overwhelming, but it's also a form of communication. Today, we're talking about functional behavior assessment, or FBA, and how it helps us understand why a child behaves in a certain way so we can better support their social emotional development in early intervention. Let's meet Maya. She's a 2-year-old in early intervention. When Maya is told no, or when playtime ends, she throws herself to the floor. She bangs her head against the ground really hard. Sometimes this lasts for 15 minutes, and she's very difficult to comfort. Her parents are scared that she's going to hurt herself, and they feel pretty helpless. So here's how the EI team might use the FBA in this case. The antecedent is the playtime ends. A parent says, "It's time to clean up." The behavior is that Maya is screaming, she's throwing herself down, and she's banging her head. The consequence is that the cleanup is delayed while her parents are comforting her. So after observing and talking with the family, the team learns that Maya's still learning how to handle transitions. She doesn't yet have a way to say, "I need more time," or "I'm not ready to stop yet." She feels overwhelmed when the shift is sudden. So what looks like extreme behavior is actually Maya's way of saying, "I'm not ready," or "I need help with this transition." With this insight, the team and family can put some supports in place. They could add a visual cue, a cleanup picture card, so that Maya knows what's coming next in her routine. They can give her choices during cleanup, blocks first or the book first, so she feels some kind of control over that situation. They can teach her a simple replacement skill, like holding up an all done card or using a single word so that she can communicate instead of melting down. They can use a predictable routine and a cleanup song so transitions feel familiar and safe for her. Soon, Maya's going to begin to transition with fewer meltdowns, not because she's being forced, but because she has new tools to help understand, predict, and participate in what's happening. FBA is a powerful tool, especially for young children who haven't yet developed language or emotional regulation. It's important to remember that FBA is not just about stopping behavior, it's about understanding it. In early intervention, we can look at developmental appropriate expectations while also noticing when behaviors are unusually intense or persistent. We can support children within everyday routines like meals, playtime, or bath time. We can help caregivers build predictable environments and routines, teach replacement skills, and nurture social emotional development. When we understand the why, we can support the how, giving young children new ways to express themselves and helping families and caregivers feel more confident. Many challenging behaviors are expected in early learning, but when they become overwhelming or extreme, families do not have to face that alone. Challenging behavior can feel overwhelming, but every action is telling us something. By paying attention to patterns, especially frequency, intensity, and duration, we can tell when families need extra support. Functional behavior assessment gives us the tools to listen closely, support development, and help children, families, and caregivers thrive. If you're seeing big feelings or behaviors in a little one, don't wait. Let's talk this through and try to figure out what this child might be trying to tell us. Behavior is communication.